Mhm.
Okay, yes, we'll start.
Okay.
So,
Hello everyone. Myself Harish Krishnappa, a GMC registered doctor. I'm going to start my going to be a doctor as a going to be a junior clinical fellow in general medicine Wales. And here is my colleague Nishita Gandhi. She's a GMC registered doctor, and she recently got a job as a trust senior house officer in London. Okay, today we are going to discuss about prescription writing. We are going to explain to you all about the basics of prescription writing, and here we have the objectives for today. These are what are the important details, writing the important details, and how to use BNF, how to manage time while writing prescription, and how to keep the answer sheet neat, and practice how to practice prescriptions daily every day, and mentioning the dates that is required for the prescription. Okay, let's start today. Go for the next slide. Okay, this is the prescription sheet. Where you can get this prescription sheet is from GMC portal. Actually, you can go and download. Otherwise, we'll post this prescription sheet in Telegram group, so you can download and take printouts, and you can start practicing. I'm going to explain to you when you are in exam, when you are at PLAB 2, when you are inside. So before entering the hall, you'll have the 2 minutes of time to read what the question, or like what you're going to do in the next 8 minutes of time. So once you go inside, before you go inside, you have to see, okay, what case I have, what are the drugs I'm going to, if at all you come to know what are the drugs and what are the dosage. You have to keep yourself calm before entering the hall. So once you're actually after 2 minutes, you can start going inside, and so this is the prescription sheet. So I'll tell you the details of what are the things here. So in the right corner, there'll be a hospital number, name, address, date of birth, and NHS number. This is patient details. Usually they'll be giving you the information about the patient. If at all they didn't give you any information about the patient, they have maybe given a sticker or something to just paste it there. Don't forget to do this. It's very important. Because,
so can I interrupt Harish? What Harish said is very important because many people, when they have a prescription station, they tend to forget like they're very panicking and they're about completing the station. They tend to forget there is a sticker they can stick. Instead, they keep, writing the whole details and waste time on that. So please don't do that. Continue, Harish.
Yeah. So once you fill the patient details, and it comes to the left corner, that is the ward, hospital, and the consultant under whom the patient is admitted, and the date of admission. If at all the date of admission is not given, it will be usually your exam date. Okay, so remember this, and they usually give weight of the patient and height of the patient, and date written. Usually it will be the same date of admission. It's on the same date will be prescribing the medication, so it will be the same date. Can write it down. So once you are done writing these things, next comes the VTE this assessment form. Okay, it's usually a set of questions that you need to ask the patients. It usually sometimes it'll be present in the room, or sometimes don't be there. But all you do that, you have to tick this box. You have to tick the box. So once you are done with the asking questions about risk assessment for VTE, you have to tick this box. Once you tick this box, next comes the next section, that is allergy or sensitivity. So usually many patients may have allergy to specific drugs. Could be a penicillin, it could be any other drug which they are allergic to. They would have given this in the question, whatever you get there. The information will be given to you. If at all there is no information, you can ask. Otherwise, if at all they mentioned, you have to write what are they allergic to. If at all if they are allergic to any drug, you have to write what are the reaction it causes. What is the reaction? It can be rash, can be a anaphylaxis, or it can also be any swelling. So write down in the right side actually what are the reaction the patient is going to have. And if at all the patient is not having any allergy to any drugs, you can write no allergy. Actually, you can write it there. Then most important thing is you have to write your name and signature and write your GMC number in this box. Never forget doing this, and mention the date here. That will be the same date of your exam, or they would have given to you. Okay. Next thing comes, if at all they have given you information about multi-drug resistant Staphylococcus aureus. They would have given the information to you before. So if at all, if you have the information that the patient has multi-drug resistant Staphylococcus aureus infection, you have to tick the box. Any medicine sensitive Staphylococcus aureus, then you have to tick that box. So if at all they've given you the information, you need to do this. So once you tick this box, next comes the once only medication. These are the medications. It can be a loading dose, which is given only once. So once if you have this medication, write it here and no need to write anywhere else. So what all things you have to write here is mention the date and at what time the medication needs to be given to the patient and what drug you are giving to the patient. One more important thing is you have to write it in capitals, block letters, and using black pen is very important. That's what usually commonly used in UK. You have to write it in black pen, not in pencil. And what is the route? You have to write here the route, whether IV or subcutaneous or oral route. And what is the dose? Next comes the prescriber signature and bleep number. Signature and name you can write, and the bleep number will be given to you. Other important thing is how to check for the dose. If sometimes the dose may have given to you, or the dose they're not given, but they have given you the information about what the condition the patient is having, whether he's having any infection or is having any disease. So once you have the diagnosis, you can use the BNF, open the index actually, and mention check for the infection. If at all the patient is having pneumonia, go for the check for the pneumonia and see the pain number. There you are going to decide the dose depending on the it may varies on age or weight of the patient. So once you know the age and weight of the patient, you can choose which what the dose for the patient, and you can write it down here. Okay. Once you are done with this, then this comes the oxygen part. Usually, yeah, they're given like you have to mention the year of which we are giving the oxygen and date and month here. And yeah, they are given you the saturations 94 to 98% and 88 to 92%. Is usually COPD patients usually we maintain oxygen saturation around 88 to 92%. So you can circle that and move forward. So after the first page is done, you can go to the next part, that is antibiotic prescription. Go for the next slide, please. Okay. So in antibiotic, so what need to be written in antibiotic section? I will explain to you. So first thing is writing the drug. I always try to write the generic name, not the brand names. Is always write the generic name and write it in capitals or block letters. So once you wrote the drug, and then next comes the dose. So when you're writing dose, it's all, you need to, should not write the abbreviations. You have to mention it, like, okay, if it all is micrograms, you have to go with, you should not write mcg as such. Write it micrograms. Even the space is very less. Try to write it as micrograms. If it all is in nanograms, don't write it as ng, write it as nanograms. And write it as units. If it's units, write it as units, not as just U. So these are very important while writing dose. Okay. Next is using decimal points. So when all, if at all you have a drug which is less than 1000 milligram, you always try to write it as, okay, let's think it's the dose is 600 milligram. So write it as 600 milligram, not like 0.6 gram. So it's always better to write it as 600 milligram. Okay. And if at all you have try to avoid decimal points. If at all you have a 5 milligram drug, don't write it as 5.0 milligram. If at all that dot is not visible, it could be sometimes they may read it as 50 milligram. So be careful in these when writing prescription. Okay. Next thing comes the route. Okay. So you have to write the route, what the route they are going to take, whether it's IV or it's subcutaneous or it's they're taking orally. Next comes the date actually. So always practice, take the prescription printouts, start practicing like your exam date, start writing considering your exam date. Usually sometimes it could be very useful for you. So when writing antibiotics, sometimes it could be loading dose and they can be maintenance dose. So if at all you are having a maintenance dose, a maintenance dose will be if at all loading dose will be written in the first page because it's given only once. So when it comes to maintenance dose, it will be given from the next day, not on the same day. So what are you going to do on these conditions? So crossmark indicates that you are holding the drug. So if at all you're providing the loading dose today, you can mark mark as cross here, so that the drug is not given on that day and it will be starting from the next day. So marking a cross mark is very important when if at all you are not giving the medication on that day actually. Then continue the medication, write the next states, continue here. Okay. Next thing is here you have to write the start date and stop date. For antibiotics, usually it depends on the condition, whether the infection is for whether the infection is severe, the number of the antibiotic will be given for 10 days. If at all the infection is not severe enough, it will be given for 5 days or 7 days. You have to check these details in BNF and write it down. Next is writing your marking your signature and name and GMC number is very important here. Believe sometimes it will be given to you, so you can mention that. And what are the indication? Why are you giving this antibiotic or the antibiotic to this patient? If at all it can be a lower respiratory tract infection, any other infection, you can write it down in the indication part. Next comes sensitivities. If the patient has any given sensitivity, you can write it down. Other if it's not given, you can leave it empty. Then micro approved. If at all they given you anything, any information regarding this, write it down. Otherwise, you can leave it empty. Next, additional information. If at all the patient needs to take this medication before food, after food, or in the night, you can write it down as additional information. That will be useful for the patient. So Let's go to the next slide now.
Adi, can I add 1 or 2 points?
Yeah, please.
So in respect to antibiotics, always know what antibiotics you should avoid. Maybe when you read the question properly, the patient might be pregnant, so you should know what all antibiotics you should avoid in pregnancy. And again, like Harish told, you should know the duration of antibiotics. It might change with the gender as well. It could be 3 days, 5 days, 7 days, 10 days. And you should also see if the patient has any liver or kidney ailments. In that case, you have to look at how much is the dose we can give for a certain creatinine clearance, or certain levels of blood results. So you should be very careful on all these aspects when you prescribe antibiotics, duration and time as well. Over to you, Harish. Next slide.
Yeah. Next comes the regular medications. These are the medications which are taken daily. They will be given in 2 pages because the number of regular medication the patient would be taking more, so they'll be given 2 sheets for regular medications. So when it comes to regular medication, you are no need to. Okay, can you go back to the previous set? Sorry. Yeah, in these slides, antibiotics, you need to write the timings when you are going to give the medication to the patient. It should be in 24-hour format. Like for 8 o'clock in 8 a.m. rate it 8 a.m. or in the afternoon 1 p.m. can it just 13 or 13th hour. So you have to rate it down. If you tell the PD or what time you are going to give medication, you can write it down here. Right. Next slide. Okay. In regular medication, you need to write the time because they already given here. The time is like morning, midday, evening, on bedtime. So here, what people usually forget is writing the year, what year it is. This is the common mistake people make when they're going for the exam. So don't just how to avoid this is keep practicing. Take the printout, take it, take to the home. Practice every night. Make it a habit. Just whenever you're bored of doing scenarios, start practicing prescription because practicing really helps you learn more. Even though I teach you whatever I know, it usually works out when you practice on your own because you'll have a lot of doubts after when you start writing the prescription. You can always ask doubts in the group. We will always be happy to solve your doubts. Next year's you can write the drugs here and dose and the route, whether IV or subcutaneous or oral route. Usually the stop date won't be given here because the regular medication they will be taken for months and years, lifelong. So the only the start date will be rating here. The stop date you won't be rating in regular medications. So next is in every prescription you need to write your name, signature, and GMC number in this box. And if at all they're given you any bleep, you can write it down here. Next, additional information. So what additional information you are going to give to the patient? Whether the regular medication, there'll be a lot of medication. So which time will be suitable for them? Whether it'll be in the morning or you give it in the evening. So which medications usually what time can write it in the additional information? Next thing is if at all the dose is very if at all the dose is changed, if at all in store conditions, the medication will be given IV in the beginning, then they change to oral. So in these conditions, regular medications you have to write it to first you have to write for the first route, that would be IV route. The next column next row you can write it for the oral when they change to the oral route. So you can write it like that. And any other condition where you can change the route is when you have to write twice is when there's change in route, whether it's change in IV to oral or another condition like giving 2 doses, like loading dose or maintenance dose. You have to write it twice, one for the loading dose and one for the maintenance dose. It's dropped it. Okay. Yeah. Please go to the next slide. Okay. Required medication. As required medication, it's usually one second, sorry. As required medications is the medications which are taken when the patient feels like is required for him. It will be commonly the painkillers or bronchodilators, painkillers like paracetamol, analgesics, which need to be taken when the patient is having any pain. It's only taken when the patient wants. You can write the peer and no need to take it, but all the patient is fine. Other medications are like salbutamol. It can be used when the patient is feeling breathlessness. So, once you write the drug, there will be an indication. Okay, why why this patient is taking this medication? Write the indication. If at all you are giving paracetamol, it can be for the pain. It can be for the fever. If at all you're writing NSAIDs, it can be for the pain. Write it indication. Severe pain or pain, you can write it as indication. But all the patient is taking salbutamol. The indication could be one of like breathlessness or shortness of breath. You can write it as an indication. Next comes the dose. What are the dose like? You can mention the mg for inhalation. So you have to write it as puffs. How many puffs you'll be taking for once? And what are the route? Route for inhalation, you can write inhaler. You can write it as inhalation. And for the frequency, how often do you take? If you can write it down like 4 hourly or 8 hourly or 4 times per day. So on maximum in 24 hours. You can write it as a dose, like for like 40 mg in 24 hours, or you can write it number of times you can take in the 24 hours, like 8 times or 4 times in 24 hours. That is how you're going to write it here. Next is signing for the prescription and writing your name. Mentioning the date and the bleep number. Additional information you can give to the patient. Anything that if you take should be taken in the night. It's as required medications, so no need to write. Like if you need any further information is not given. If at all you need to tell the patient, you can mention it there. Okay. Let's go to the next slide. Okay, PNF as I was telling you, sometimes you'll be provided the dose, you'll be provided the medication. In that condition, no need to worry about, no need to worry. But still, you need to cross check. Opening the PNF and checking for the drug is very important when you are attending prescription scenario. So always cross check if at all you are they're given the infection or disease to you. Just go and check in definitely. Put on the given pneumonia, go for the pneumonia, check for the pain number, go there. Then there'll be a list whether hospital acquired pneumonia, whether it is for community acquired pneumonia. So in pneumonia, there'll be a number of doses depending on weight of the patient and depending on the age of the patient. And there'll be some drug interactions. Sometimes you need to consider those. I'll be explained in later slides. So once you know the age and once you know the patient condition and the patient weight, you can check which is for the patient, and you can prescribe medication accordingly. Sometimes you have to write medications according to the hospital administration. So some hospitals they'll have their own guidelines. Few hospitals they have their own guidelines, so they follow a certain pattern of giving antibiotics. For some hospital they will divide the doses depending on like weight of the patient or age of the patient. So in those cases, you'll be given the hospital protocol. What are the protocol they'll be maintaining for prescribing the medication. So once you have that thing, and if you have the weight of the patient, you can choose those medication accordingly. Okay. Next, let's go to the next slide, please.
Harish, can I add one more thing? So apart from prescription writing stations, whenever you find a station where they have you have to explain about medications or anything to that matter, if there is a BNF in front of you and you are also very pretty sure about probably side effects of the drug, or you can explain the drug very well, open the BNF once, that because it might give you a brownie point. The person opposite to you might be impressed or whatever it is. So whenever you find the BNF in any station, try to pick the BNF and go through it while you're performing the station.
That's very important. Like I totally agree with Sibi because in like we are from different countries, so we people don't even know like what BNF is according to them. As in, do we go into some book and then only prescribe the medications? So this is something good which you guys will do. Basically, they'll have an idea that person is not ratifying the drugs. He or she is just looking into the BNF and knows the importance of BNF at that point of time. Okay.
Yeah.
It can come in the cases like UTI. Suppose you have to give nitrofurantoin, you have to give trimethoprim. We all know, okay, the drug we have to give for UTI is this and this. But it's better if you have a look at the at the BNF. It makes you a safe doctor. Okay. Please continue, Harish. Thank you.
Yeah. See, as my colleagues told, it's actually very important to open the BNF just to make sure that you're prescribing the correct dose to the patient and you're being a safe doctor. Okay. Next thing comes the time management. How you're going to manage your time. The best thing to do is once you enter the exam or once you enter the PLAB scenario, you'll be like tense most of the time, and you can't even see like what are kept there. You won't even see whether they're given any sticker, they're given information. You'll be skipping. You'll be like, hurry, okay, I need to write and finish it off. That's usually it's common. Everyone does that. So what you're going to do is just try to be calm. Don't be tensed. Try to focus what is there in front of you, what the information they are given to you, and what you have to write. They'll be giving you the most of every information. So you have to just check there and write it down in sheet. Or if at all they've given you some sticker or something for the patient details, please see and paste it there. And there'll be BNF, so don't forget to use BNF. Always use BNF and be a safe doctor. So once you start writing your medications, so you always try to finish all the medications. So you'll be a hurry, and sometimes you'll miss the date, or you may miss the year, or you may miss the dose, frequency. So it's always better when you're starting to take medication. Always go in order. Don't feel like, okay, I'll fill it later. Go from the first page. Yeah, still fill from there. Then go for the next page. So it's always better to finish at once. Like you start from beginning and end it. Don't again think like I'll come back and write it, because in that situation you'll be already tense. You'll never come back and finish those work. So always mention the drug and dose. This will be very important. So once you start writing the medications, you always feel like you have to complete every medication. So don't worry if at all you are not able to finish all the medications. If you're not able to complete every medication, don't worry. They'll be scoring you based on how you prescribe the medication. Okay, whether you prescribe the first medication correctly. So they'll go in order. So it's always try to complete the prescription if possible. If at all you're not, you don't get tense and don't, keep writing even after the bell, bell is rang and before they ask you to go. So don't keep writing it. It shows you're not a doctor. So just try be alert, write as many prescriptions as possible, write as many drugs as possible to you. Try to complete it. If at all it's not, you're not completing, don't need to worry. You can move forward for the next medication, for the next scenario. Okay. Do you guys have any doubts? You can always ask for the doubts. Can you please ask me any doubts? Guys? I know you like there'll be a don't hesitate to ask. Even I was like, we are all been there, so please ask some doubts. If at all we know the doubt about this, then we'll inform you. Otherwise, we'll definitely find it and let you know. Anyone has any doubts? That's fine. But the thing is, like, use take the printouts. Start practicing from today. Once you start practicing, you'll have lots of doubt. Okay, what I should write here, and what should I should not write. There'll be a lot of things that you
Definitely.
Yeah. So start practicing from today. Don't think I'll do it in the last few days. Yeah, anyway, prescription is in any form. Don't think.
Definitely.
Yeah, prescription is a thing that you need to do every day. You need to have the touch, use the touch with the prescription. So
And guys, it's a station you can easily pass.
that's true.
Exactly.
Yeah, it's like a guaranteed station for you to pass. And one more point I want to add is like what Harish told us, don't continue to write after time is over. And before you leave the station, make sure it's all very tidy because that is your IPS points for your prescription station.
And once you enter the station, don't forget to greet the examiner, please. In
Yes.
that panic mode, at times you miss greeting the examiner. You have to greet the examiner. That's very important. Okay. Otherwise, one more thing, yeah, I agree. At this point of time, it's difficult to have doubts because you haven't practiced. But once you start practicing, you'll have lots of doubts. You'll have doubts how to look at the BNF, how to go for indexes and all. For that, we have shortcuts, but for that, we will tell you that. But for that, you have to practice. So practice and then accordingly ask doubts. But till the time, if you have any doubts with Harish, like if he has taught you something and you're not getting something or you have some queries, you can ask him. Then I'll continue.
Yeah. That's the thing actually. Be alert. Just look for the information they have given to you. Sometimes there may be a sheet there that the question that you need to ask the patient, and sometimes there will be a hospital protocol that you need to look into that and check patient weight and prescribe the medication. So it's always very important to be calm. Just see what are the information given and write accordingly. And
Yeah,
keep
in
everything.
fact,
Yep.
I'm sorry. No, continue. I'm really sorry. You continue.
So please make sure that you have kept everything neatly there. And there'll be a pen. Just take the pen. When you take it from there, keep it in the same place. That shows that your theory and you keep things neat. It's very important for your IPS. Yes.
Definitely. Yeah, and remember to choose black pen, guys. Don't go for blue pens. They will confuse you. They'll give you blue pen, red pen, green pen, black pen. Choose black pen, okay? I did that mistake. I picked up the blue pen first and I was like, no, 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 I want a black pen.
Yeah.
So be
And
very much careful about that.
so, what to do if at all you write a prescription wrong? Like, if at all you're using small letter, if at all you did something. So, what you're going to do? So, what you're going to do is you have to mark it as zigzag way, and you have to write your name, date on which way, like, and your GNC number. It's very important. Don't leave it like that. You feel like I'll scratch it later. No, once you did wrong, just make sure that you clear it there and you move forward. Hope you
Definitely.
get it. Yeah. Okay. Now Dr. Nishita will start explaining the remaining slides.
Thank you, Harish. So now, guys, I'll take over. So I'm Dr. Nishita Gandhi, and I'm soon shifting to UK for my job. So I know you guys are at a stage where you have to give PLAB to, and it's kind of tough and like depressing as well at times because it's a different exam. I totally understand, but trust me, everything will fall into place. That's all I'll say. So I'll start with the topic of prescription. In fact, I'll continue with the topic of prescription. So I'll just start sharing the slides. Siddhi, are you comfortable sharing the slides?
Yeah,
Okay,
yeah,
I'll
yeah, I can continue. Sorry. Yeah, yeah. 1 second, just wait. I'll just stop sharing.
yeah.
Yeah, you can start sharing. Nish.
I'm sharing. Can you guys see the screen? Siddhi, is it visible?
No, it's not.
I don't know what's happening. I think you only continue. There's some issue happening here. There's an arrow rotating. That's all. Mhm. Thank you. Okay. So, as Harish and we were discussing, remember to use black pens. That's very important. And maintaining neatness, as in whenever you enter, don't enter in like a haphazard manner and start throwing things just to be quick and all. And guys, remember to open BNF because at times I'll tell you honestly, people forget to open BNF because they remember what kind of cases are going to come, or maybe they know the drugs. As I was giving you an example of UTI, you know what is a drug for UTI, that is nitrofurantoin or trimethoprim. You will prescribe it, you will have to give it for 3 days. We remember because this is how we have been taught in our home countries. But in UK, if you are entering, don't forget to open the BNF. At times I agree there are some like lengthy cases as well. Suppose if you have to prescribe palliative medicines, in that case there are lots of medicines, are you getting? Suppose you have to prescribe a painkiller, you have to prescribe one for controlling secretions, one for cough, one for some other thing. There are plenty of things which you have to prescribe in palliative medicine. At that point of time also, don't forget to open the BNF. Do open BNF, that is very important. Okay, so can I have the next slide please, Sibi? Yeah. So yeah, practice. Practice is the key here. Practice will make you perfect. Remember to buy lots of printouts or take out the printouts and then only go to UK, because honestly in UK the printouts will cost you a lot. So it's better you take few printouts from here in practice. Practice a lot. Practicing is very important. And remember to practice with the date. And yeah, remember to paste that sticker. Don't forget to paste the sticker. And generally in this thing, guys, are you able to hear me properly? I don't know why I think my voice is repeating.
No,
Sibi, is
we are
everything
able to hear. No, we are able to
oh,
hear you properly, Nishita.
okay, thank you, thank you.
Yeah.
So do remember to like open the BNF as I was telling you in practice. Yeah, so how you're going to practice is uh, write the date of your exam on the date section. Write your GMC number and your sign. Suppose my name is Nishita Gandhi, so I'll sign it as N Gandhi or Dr. Gandhi. Don't in UK people avoid the first names, so go for that. Okay, use the surnames. Practice with that, and as Sibi and Harish mentioned, don't forget to paste that sticker. Don't start writing because it will waste your time. Okay, then one more thing I would like to suggest you, since PLAB 2 is an exam and like we have to go for do many things, like we have to deal with angry patients, we have to deal with ethics, we have to deal with some counseling stations, and then only we have this kind of a prescription. And the second thing which we have is Simmons. So prescription and Simmons is something which will come in your exam for sure. So I'll suggest you to practice daily. For prescription and Simmons, like you have to give 1 hour daily before sleeping. Just practice one scenario of Simmons and of prescription. Okay, if you'll do that, you'll have a habit of doing it, because prescription is something and Simmons are something which you can't complete in one day. So even if you have that kind of attitude, okay, I'll give 2 days to this and I'll complete all the prescriptions, or I'll give 2 days to Simmons, I'll complete all the Simmons. It's impossible. It's better to do counseling session, do practice with your friends, but before sleeping, do one prescription and one Simmons. Like in total, I think in your course we have like 25 to 30 prescriptions, not even 25 honestly. Okay, I'll say 25 prescriptions. If you're practicing one daily, it will be over in 25 days, so you can practice each prescription twice in 2 months. Okay, if you're giving 2 months of period for a PLAB 2 preparation, it can be easily done. Okay. Okay, can I have the next slide please? Exactly, mentioning correct dates, that is the most important thing. So that I was mentioning, make a habit of writing your exam date, practice with your exam date, practice with your name, about the timing as well. So just have a look when your exam is going to be. It's going to be in the afternoon or the morning slot. Practice the timing as well. And dose. For dose, the only thing which is going to save you is BNF, guys, because BNF, even if you try to recollect or remember things, trust me, you won't be able to. You'll get confused. 25, 24, 23. How will you remember? For this drug, you have this much. So you can't. It's better go for the BNF and see the doses. I would suggest you, okay, you can have in your mind, okay, what drug is given for what kind of a disease. If a person is allergic, interactions, that is something which you can buy at, that can save your time. But doses you have to definitely see from the BNF, even if it's in the exam or in the real clinical practice which we are going to carry forward in UK, we have to refer to the BNF for the doses. Okay, so Sibi, can I have the next slide please? Yeah. So as I was telling you guys, like we have to, we can memorize, or maybe we should know few drug interactions. I think these are some interactions which we were taught in our medical schools as well. So first interaction which you guys should remember is we can never give statins along with clarithromycin. Suppose if the clarithromycin, we are going to give clarithromycin for 5 days, BD I'm going to give. For those 5 days, you have to stop the statins. So how you're going to do is, suppose there's a prescription paper, okay? Clarithromycin and statin is continuing. So clarithromycin, you're going to give an antibiotics, as Harish told you about the antibiotics in the regular medicines. So suppose you have mentioned clarithromycin and antibiotics. Then you have mentioned statins also in the regular section. Then you'll cross those 5 days, and after that you can continue statins, not during the clarithromycin. Okay, remember that clarithromycin and statins can never be given together. Okay, and there may be a scenario. In fact, in most of the scenarios, they'll tell you the patient is allergic to penicillin. The patient gets a rash because of penicillin. So what you're going to give? Clarithromycin. And if the case comes, if the person is allergic to penicillins and clarithromycin as well as azithromycin and these kind of drugs as well, then what you're going to give? Then we are going to give doxycycline. So there are cases like that. So you have to keep in your mind, okay, so what time we have to, what drug can't be given if a person is allergic to so and so drug. Just try keeping in mind, okay, so now I'll give this drug. This is something which you shouldn't see in BNF considering the time constraint. But if you are very quick and you can do it in BNF, and you're not good at remembering, and you're better in like uh, changing the pages and going through a book, if you're a reader, it's very easy for you, then I would suggest to go for to go for the BNF. But if you can just remember 3-4 points, it's better. Okay. There's a case I'll tell you. Suppose a person is having a peritonsillar abscess. Okay. In that case, what we are going to give is benzyl penicillin, as the patient is mostly going to be allergic to clarithro, because clarithro is the first line of drug in abscess. Okay? But if by any chance if the patient is allergic, then you have to give a benzyl penicillin. And peritonsillar abscess is something in which we have to give fluids as well. Okay, so for giving fluids, there's a different kind of a paper. I'll show you that paper. If I'm able to just, I'll show you that, guys, that paper afterwards, or maybe I'll send that paper to Sibi, and Sibi can present the paper in the end. Sibi, I have sent you a picture. Can you please open that?
Yeah, just wait. Can you see it?
Just can you rotate it if possible?
Rotate it.
You have to edit it.
Can you see now?
Can you rotate it if possible?
I tried rotating it.
Just the right side rotation.
Just the right side rotation.
You rotated it 360 degrees. I don't know why my thing is not happening. Okay, it's fine. It's fine.
Okay.
We'll do it in the end also. Guys, can you see it? Can anyone reply? Yvonne or Rekmon? Can you see the picture? Can anyone reply? Yvonne? Okay, no problem. It's not clear. Okay, so now, guys, look, this is going. Now I hope it is fine. So this kind of a paper is going to be given when you have to give the medicines, when you have to give the fluids. It's fine. I think we'll do. I'll share the screen in the end. Then I'll tell you about the fluids. Okay. Just continue with the slides.
Okay.
Yeah. So, okay. Can I go back to the last slide? Yeah. So we were talking about peritonsillar abscess. So next point is never prescribe AC inhibitors, that is like ramipril, if the patient is hyperkalemic, like there's an excess of potassium, there's a reduced GFR. Never go for ACE inhibitors. It is very important because it will affect your kidney even more. Okay, you know that ACE inhibitors are nephrotoxic. Then in the end, we have NSAIDs. Yeah, never give NSAIDs in lithium toxicity because NSAID increases the level of lithium. So now I have given you these points. Okay, you must be thinking, okay, why is she giving these things? Like, but when you like solve the prescription questions, it is really going to help you out because the cases will be very simple. Okay, the cases will be like a 9-year-old boy is suffering from peritonsillar abscess. Prescribe amoxicillin. Okay, or prescribe clarithromycin, and in the next point it will be given the patient is allergic to clarithromycin. Then how will you deal with that kind of a situation? At that point of time, you'll remember this thing. Okay, so this was taught to us. Whenever a patient is allergic to clarithromycin and peritonsillar abscess, we have to give benzyl penicillin. And how we are going to give benzyl penicillin is 25 milligram per kg. But it's fine if you don't remember how 25 mg per kg because you can always see in BNF. Okay, but these are the points. Just remember them, and then if you start solving the questions, if you start solving the prescription things, then it will be very easy for you guys to do it and very quick. Okay. Can I have the next slide, please, Sibi? Yeah. So, yeah, treatments for some important diseases, which are common in UK and which may come in your exam. Like, suppose if a patient is coming with an MSRA infection, like he got positive in the hospital for MSRA, what is the thing which you're going to do? In these kind of cases, you know what? You don't have to see the BNF. You will be given a different kind of a paper for the vancomycin thing, for the MSRX infection. And what is going to be, you have to just see the age, you have to see the gender, and then accordingly you have. This call is now. Hello, am
Yeah,
I
Nisha,
audible?
yeah, we can.
I'm really sorry. Actually, my laptop got hanged. I don't know what happened. I was trying to
That's
just share the screen. Sibi, can you please continue?
yeah. Can
And
you
really
see the
sorry.
screen?
No, I can't see your screen.
Just a second. Yes. Can you see now?
I can't, guys. You guys can. Like Harish, can you see the screen? Yvonne, can you see?
We can see the screen.
Just
Yeah.
with me.
I think we are on the 13th slide. I think
Yeah.
if you have the slides, just go with the 13th slide.
Okay. Can I just also share yours? Just a second.
If
Can
you're
you stop sharing? Okay, no, it's fine. You only share. Okay. It's
no,
13
no.
slide which we are going on. Right?
Yeah. If you can share your slides,
No,
I'll
it's fine.
share.
Only share. There's some issue going on with my laptop.
Okay. Yeah, as we were discussing already, we were talking about, MRSA infection and, vancomycin. How are we going to prescribe vancomycin? Dr. Nishita was discussing about that.
Exactly.
Yeah.
So MSRA infections, MRSA infection. I'm sorry, MSRA is going on in my mind. I'm really sorry. So it's like vancomycin. So what will happen at that point of time is you will have a paper. Okay. That is going to be a very different paper than the normal. It is not going to be a BNF where you specifically have something for vancomycin. Okay, so you can search on the Google, because honestly we can't share each and everything, and like it's honestly it's a bit against the policies. So it's better you go and have a look on nhs.jobs or maybe NHS site where you can have a look of MSRA treatment. Okay, and exactly that sheet will come when you'll be sitting for the exam. Okay. um then we have the second disease which we have is premature rupture of of membrane, which generally happens in females who are pregnant. So what we are going to give in that case is erythromycin. Okay, so what we give, there's two medicines which we give, which are like erythromycin and dexamethasone. Okay, and remember to look at the doses, because here the doses are going to be given according to the weight, age, and everything. So do remember to go and see the doses for erythromycin and dexamethasone while you're in the exam and while you're writing, because doses is something which you have to see by BNF. Okay. And then this one case which comes is of diabetic foot infection. That is also a very important and very regular case which comes. What happens in what we give in this is we basically need to give a antibiotic. Okay, so what kind of an antibiotic is given? In diabetic foot, we have to give a medicine known as gentamicin. That is also an antibiotic. And again, see the dose, because it matters like according to the weight of the person, according to the gender. So for these for diabetic foot infection, we have to give gentamicin. Okay, and along with gentamicin, what happens in this one is like in the question it will be given for you to prescribe a coamoxiclav, or maybe prescribe any kind of a penicillin, amoxicillin. But in the next point, it's given the patient is allergic to coamoxiclav. Then how are you going to deal with that kind of a condition? So at that point of time, you should be knowing, okay, what is the alternative for penicillin kind of drugs. So here the alternative is cotrimoxazole. Okay, remember guys, in if it's a diabetic foot infection and if the patient is allergic to penicillin, do give cotrimoxazole. Don't go for clarithromycin here, please. Okay. Next, what we're going to discuss is like yeah. So there's a case. Can I have this next slide, Sibi? Okay. So what happens is there's a case in which a syringe driver, like we have to give a medicine by a syringe driver. Okay. So how you're going to give the medicine at that point of time? So as I've shown in the picture, there's a in the suppose there's a morning, afternoon, evening going on. So how you're going to do is you are going to make a loop around that, because syringe driver is something which you never give BD or TID. It is something which is attached to you, and you have been given the medicine in small amount whole day. How you're going to do it, how you're going to portray that at that point of time is just make a loop around the days. That is like a time period, like morning, afternoon, evening, night. Just make a loop and remind you guys it should be very much clean. Okay. Sibi, can you stop sharing the screen so that I can share some pictures with them?
Yeah, yeah, sure, sure. Just give me a minute.
Thank you. I hope I'm able to share.
Yep, stop sharing.
Guys, can you see the screen?
Yes, we can see the screen.
Oh, fair. So, yeah. So I'll show you one example. suppose this is the case, okay? UTI. So the patient will, how will the patient present? The patient will come with you with the abdominal discomfort kind of a thing. And we'll ask her about the menstruation and all. She'll tell it is 3 weeks ago. So allergies and all. So what happens that sometimes is when you enter the cubicle, there's a patient there. Okay, so you have to take the history and then write. This generally happens in which the prescription is very small. So this is one of the cases which is coming in my mind, and I want one of you guys to discuss this case with me. So who is up for it? Tell. Yvonne or Rekmon, are you guys ready? Just a discussion. I'm not going to ask you guys anything. We're just going to discuss what we are going to do, what we can do in this kind of a case. Anyone?
I can try, but I'm not really sure how to do it.
It's fine. Very, very good, Yvonne. So I'll just show you the question. Okay, yeah. So, so tell me what kind of a medicine. So suppose I'm a patient sitting in the cubicle. Just ask me a few questions about okay, what happened. Take a small history from me.
Okay, so hello, I'm one of the junior doctors here. Can I confirm your name and age, please?
Sure, doctor. I'm Nishita and I'm 25 years old.
Okay, hello, Nishita. I can see that you're coming with some abdominal discomfort. Can you describe to me how is it?
Doctor, it's paining like anything. Like I am having a lower abdominal pain. Like here, it's paining a lot, and like I'm having this pain for like past 1 week.
Okay, does this pain come and go or it stay there continuously?
I'm sorry, I couldn't understand, doctor. Sorry.
Is the pain comes and go or is always there?
It's always there, doctor.
Okay, do you have any fever?
Mm, yesterday I was feeling a bit warm.
Okay, do you have any pain while passing urine?
At times I do have.
Okay, how long has that been?
Doctor, it's been like two 2 to 3 days. Like I'm having burning sensation while urinating.
Okay, I see. Do you notice any change in your urine color?
No, doctor.
Is that increased frequency you're going to the toilet?
I think so, doctor. Doctor, can you please prescribe me the medicines? Actually, I'm here for just my prescription.
Okay, so I'm suspecting that you might have conditions called urinary tract infection, which means there's infections in your uh private part, which is the part you pass urine. However, I need to ask you more questions just to select the right drug for you. Are you okay with it?
Yeah, that's fine, doctor.
Okay, I can see that your last menstrual period was 3 weeks ago. Can I ask, is there any chance that you are pregnant?
I don't think so, doctor.
Are you currently on any contraceptions?
No, doctor.
Do you have any drugs do you have any food or drugs allergies?
No, doctor.
Are you currently taking any medications or supplement?
No.
Okay, I don't know what else to ask.
It's okay, it's fine. And then you just say, okay, I'll just give you the prescription, open the BNF. So tell me what medicine you think you're going to prescribe me.
Actually, I'm not sure how to use the PNF.
It's fine. But I think you know what medicine is there for UTI.
Trimethoprim or nitrofurantoin.
Exactly my point. Okay, you know nitrofurantoin. What you're going to do, you have an option of going to just UTI. In the last page of the BNF, there's an index, okay, where you can have a look over UTI, and then you can go to that page and know, okay, so this is the medicine which I have to give. But if you know the medicine, okay, then what you have to do, you know nitrofurantoin. You just have to go to nitrofuran and then look into UTI. Okay, so I have to give for 3 days, for 6 days, and then prescribe the medication. This is a very small and like a not a very time consuming prescription, because that's why you are really able to talk to me, like you're able to talk to me, as in you're able to take history. But in few cases, the prescription, like I was telling about the palliative one, okay, the prescription is damn lengthy, then it is going to be very tough for you. Okay.
Okay.
Okay, so it's fine. And if you don't know, it's fine. You just go to the index, look for UTI, and then just open that page wherever the UTI is, and then search. Okay, so with medicine, it's going to be either nitrofurantoin or trimethoprim, whichever you want. Just prescribe that medicine, and it can be done. Okay.
Okay.
Okay. Thank you, Yvonne. Do you have any doubts?
No. So actually, do I need to confirm patient weight and height as well, just in case that drug needs to be modified according to the weight?
What happens in prescription is weight and height is generally given outside. It is very important in the pediatric ones, the pediatric prescriptions. Okay, I'll tell you one that kind of a prescription about the fluid. Like when you have to give the fluid, then you need to know the weight of the child. Okay, and there are some other medicines as well. If the patient is present inside, you can't ask what is your weight, because the patient will also be not knowing. It will mostly be given or in the this thing in the outside the cubicle. You'll be given this thing, a paper, and then you can have a better idea. But by chance, if it is not given there also, then while taking the history, just during the examination, say, okay, now I'm going to just check your height, I'm going to check your basic exam, general examination, which you call, na? In that, at that point of time, you can ask about the weight. Okay, and then the examiner will prompt, okay, the weight is 20 kgs, the weight is 9 kgs. Okay.
Okay.
Okay, so now I want someone who wants to
Wait,
discuss.
one more question.
Sure,
Like
sure.
in this case, if we need to take history, how long we should spend in the history part?
Look, UTI is comparatively a smaller one, but you should take history not more than 2 minutes in this. Look, okay, you were taking a history, you're taking a very nice history, but in this kind of a scenario, it was not required, honestly. What you could have done at this point of time is, okay, so you have come with abdominal discomfort. Okay, can you walk me through what happened exactly? The patient will utter each and everything what happened, because the patient basically who is an actor, that person also knows what your task is. That person has come to you just to take the prescription, so he is also expecting like a minor history. If you'll ask, can you walk me through what happened exactly, then only the patient will tell you each and everything. Okay, then whatever it is, just ask. Remember asking, since you're prescribing the medicine, just ask what is important in relation to the medicine. For example, you should definitely ask if you're allergic to any kind of drugs, because at times you don't know the patient is allergic to penicillin, and then you're prescribing the patient co-amoxiclav. It can be an issue. Okay, remember to ask about the allergies, remember to ask about the pregnancies. That is something which you did very nicely. Okay, pregnancy, allergies, these are few points which you should add, which you should ask. Okay, but otherwise you can skip other things, like don't go for alcohol, or don't go for whole PMF TOSA, don't go for whole examination. It's not needed. Just take a brief history, like for a it should be a 2 minute. What I used to do, like I was telling you, just ask, can you walk me through what happened? The patient will tell you each and everything. Okay, just put a general question, and then
Okay.
then the next question should be, okay, are you allergic to any kind of medicines? Okay, I by any chance do you have any you can be pregnant, or maybe when was your last menstrual period? Finish, then just give the medicine, because your main task here is to write the medicine, and because the examiner is going to check that paper more than your history. Okay, is it fine?
Okay, thank you.
Do you have any other doubts, Yvonne?
No, thank you so much.
Okay, so and yeah, we'll discuss about the fluids also. Okay, so now we have two more people, Rekmon and Rizana. So anyone who wants to discuss fluids with me? It's fine. Okay, so now I'll tell you how we have to prescribe the fluids. So what happens is fluids generally comes in peritonsillar abscess. Okay. So this is something which we have. Okay. So this kind of a paper will come. Can you guys see? Okay, so what we are going to do here is like, so here firstly we have to write the names. So firstly, suppose the patient name is Tariq Khan. So what is the case here is basically there is a child who weighs 23 kgs and who has come in with a complaint of peritonsillar abscess. Okay, so I'll show you a whole thing how am I going to deal with the case of peritonsillar abscess. Okay, so what we are going to do in peritonsillar abscess is we have to definitely prescribe some antibiotics. So what antibiotic we have to prescribe is benzyl penicillin. And if you'll open the BNF, you'll have a look. The dose for the benzyl penicillin is 25 mg per kg. And suppose if the weight of the child, this is kind of a lengthy prescription. I just want to tell you firstly that. So suppose the weight of the child, how much is the weight of the child here? The weight of the child here is 23. Okay. So what we are going to do is 25 multiplied by 23. It's going to be a task at that point of time you have to calculate. Okay. So 25 into 23 is 575. Okay. Then next thing we have to prescribe is the other drug is metronidazole. Okay, that is also an antibiotic. That how much we are going to prescribe? We have to prescribe it like 7.5 mg per kg. So again 7.5 multiplied by 23. So that is going to be 180 mg. Okay, and then yeah. So in the abscess we have pain, so we are also going to give paracetamol IV. Okay, so paracetamol IV, what is the dose for the child we give is maximum for 24 hours. Maximum in 24 hours we are allowed to give is 1 grams. So what we at one point of time we are going to give IV 250 mg paracetamol. Okay, then comes the important part is IV fluids. So how we are going to give the IV fluids here? So the weight of the child is 23 kgs. Okay. Now how am I going to? So in the side there will be a table given to you. Okay. So it is going to have a routine maintenance. How we are going to give? So for first 10 kgs, how much weight it is? For first 10 kgs, we have to give 4 ml per kg per hour. So the weight is 23. So this way we'll calculate 40 kgs. Okay. Then second 10 kgs, it is going to be 2 ml per kg. So 23. So we'll have 20. 40 plus 20 is already done. Then how much is left? 3. Only 3 kgs is left. For after 20 kgs, we have 1 kgs. Okay. So how much is this going to be? 3 kgs. So what is the total which we have? 40 plus 20 plus 3. So so what is the total we are having is 63. Okay. So how much in total fluid do we have to give? 63 into 24, which is equal to 1512 ml. Okay. So how many of what is the round off for 1512? That is 1500. And what is the bottle we use in UK for the fluid? That is 500 ml. So how many bottles we are going to use? That is 3 bottles. So this is the way we have to write. For the 3 things, that is first is for 500 ml, how much at the rate of 63 ml per kg. How did we calculate it? 63 like this. I've taught you first 10 kg, second 10 kg, and then after 20 kg it is 1 kg. This whole page will be given to you. It is going to be very easy. You just have to fill it. Okay. So this way we have 3 things, 3 bottles which are required. Okay. So now I'm going to give you guys a case. So who is going to solve it with me? Okay, why do we need to add potassium chloride? Because the case is of the case is for peritonsillar abscess, and potassium chloride is very important. And there's one more thing. If you see in the question, the amount of potassium is less. So the patient is already hypokalemic. Okay. It will be given. It's not given here, but there it will be given that the patient is hypokalemic. Okay. So that for that reason, we need to add potassium chloride. Okay. Is that fine? Okay, so now I'm going to give you guys a fluid case. Who is going to do it with me? Yvonne, Rizana, Rakmon. Guys, come on. This is the best time where you can practice. Yvonne, would you like to try it again?
Can.
Yeah, it's fine. Okay, so suppose the weight of the child is 9 kgs. And you have to give the fluids according to 10 ml per kg. So how much fluid will you give? It's very easy. 10 ml per kg, and the weight of the child is 9.
Yeah, 90 ml.
Very good. Okay, this is the way we have to calculate. Okay,
Okay.
very nice. Okay, so now Harish, do you want to take over? And if you guys have any doubts, we can just answer them.
Hello.
Yeah, hi Harish.
Hi guys. So if you guys have any doubts, please ask. So that will be very much happy to help you guys. And we can actually practice if you want. Practice also, if at all, if someone wants to do that. Or do you have doubts on any type of scenarios or anything that you would like to ask?
Guys, we are more than happy to help you guys. Please ask us if you have any kind of doubts.
It can be very simple. Any doubt actually you can ask us, because
Really
we
fine.
still be having lots of doubts.
So I don't think there are any doubts, but whatever said, like you can, we will upload this video as well on YouTube. Just go through it if you want. If you feel like you need another, session of describing only case scenarios, we can do that as well. And give us feedback of how we are, how we did all our sessions. And moving forward, we're planning to bring do mock sessions with you guys whenever we are free every week. We'll post it regularly in the group, so please do follow us. And if any one of your friends want a mock, or they have any doubts, ask them to join the Telegram group. We can guide them however we can and however possible.
If you guys want any kind of notes or anything like that, please let us know. We have things written already for you guys. Please let us know if you have any doubts or you want anything. We are more than happy to help you. Thank you, Yvonne.
Okay, guys, thank you so much for attending all these sessions with us, and we hope it was useful to you. And we hope we'll give you more sessions and more mocks that will help you clear your exam as well. Thank you.
Yeah. Thank you.
Guys, thank you.
And text us if you have any doubts.